Jessica and I'm a radiation therapist.
And my name's Jolene Jarba. I'm a radiation therapist in the Cancer Center.
So the one story that comes to mind for myself was a patient. She was here for, I think, 6 weeks of radiation. And I mean, they're only in the room for 15 minutes per session per day, but they do need to keep nice and still every day for treatment, and we do want to make them comfortable. So for her, the things that really helped her get through treatment, she was really, really nervous the first day, but became more comfortable as treatments went on because she really liked this certain band. So every day we have Bluetooth capability and music in the rooms. So every day we would hook up a phone to the Bluetooth system and play the music that she wanted. She would teach us things like trivia about the band, and we'd learn things. And she also brought in a stuffed animal that really comforted her. So we let her hang on to that during treatment. And then getting her a warm blanket as well really helped her to be comfortable with the treatment. And by the end of those 30 sessions, like I just remember the last day, she was crying, like very emotional. She really ended up like getting a lot more comfortable with treatments. Every patient is different, and it's just really important because these aren't patients we're only seeing one time. They're here for, like, a lot of them for a long haul. So it's really important in the initial interaction with the patient just to learn what's important to them and try to do whatever we can to make them feel comfortable.
We had a patient that was going through a very difficult treatment, and he was kind of debating whether or not he wanted to finish treatment or stop at the point that he was at. And we had a good relationship with him because we'd been treating him for about 5 weeks at that point in time. And as he was coming in and kind of feeling down, we said, "You just got to keep swimming. We'll get you there, but you just have to keep swimming." And then after he was done treatment, he came back a few weeks later, and he carves, and he had made us this, and we keep this outside of our room every day. And when we have other patients that are struggling, or even on days when we're having a tough day, it's just kind of a reminder for all of us to just keep swimming, and that we're all there to support each other. And I think what I learned from this was just that coming to the Cancer Center is daunting for all of our patients, and how we treat those people can determine whether or not they choose to have treatment and how their treatment goes. So it really showed me what an important role I play in a patient's outcome.